How do we perform a surgery for recurrent shoulder dislocation or Bankart tear and Hill-Sachs defect? These days we get a lot of queries regarding shoulder dislocation problem and regarding Bankart tears and Hill-Sachs defect. So how do we perform and how do we decide which surgery is needed? Usually there are two procedures which are commonly we do. We do arthroscopic Bankart repair plus minus remplissage, or sometimes we need to do open procedures like Latarjet procedure or iliac crest bone graft procedures. So how do we differentiate which surgery is needed to the patient? We get the CT scan of the patient and MRI of the patient. Based on CT scan and MRI findings, we calculate two important findings, that is glenoid tract index and Hill-Sachs index, based on which we plan a surgery for the patient, whether patient needs a arthroscopic Bankart repair or patient needs open Latarjet or iliac crest bone graft procedures. So how do we perform arthroscopic Bankart repair? Arthroscopic Bankart repair, we make three small tiny holes near the shoulder joint. Through one hole we put the camera, and through two holes we put instrument and special instrument implant called suture anchor. With the help of suture anchor, we repair the torn labrum, that is called as a Bankart tear. We repaired the Bankart or labrum to the original bone. We tighten the tissue of the shoulder joint so that it should not provide the space in the front of the shoulder. So whenever shoulder or a person's hand goes into the abduction and external rotation position, patient will not feel a popping out or the dislocation of the shoulder. Sometimes if we decide to perform our open Latarjet procedure, in which we take a graft from nearby a shoulder joint, that is a coracoid graft, along with its muscles, and we attach it in the front of the socket of the shoulder joint, and that's how we do a Latarjet procedure. Both procedures we do regularly, and it is a one-day procedure. If you have a problem of recurrent shoulder dislocations, or if your MRI suggests something like Bankart tear and Hill-Sachs defects, please do visit us to know further, and we are here to help you with the best treatment at affordable price. Please do connect with us. Thank you.